You mentioned the word Hounsfield units, and it comes out again, and I've been hearing that a bit now. This is all relatively new technology for the FDA, right? So they have a responsibility to the patient, right? And certainly a responsibility to the industry as well. And what I often find happens in my 30 years at this is people will start throwing out terms and assigning that claim potentially to their device or their product. Because at first glance, we saw this in robotics, early days of robotics, right? You would get clearance on a 510K. Now, if you want to go ahead and get a robotics clearance today, it's tremendously different because the FDA has learned a lot more in that continuum. So the Hounsfield units, coming back to that, does that run the risk of becoming a claim or an overarching reference point when in essence there's a higher fidelity to the use of that term?
So the methodology we use to characterize the tissue that's been both developed and validated based on live tissue specimens is unique to us and protected by a significant amount of IP know-how, and has been what we've been going for since the company was founded. This was a long process that didn't occur overnight to develop this in such a way, and there's no other technology that has been successful in this manner. Other tools that are using Hounsfield unit thresholding do exist on the market. There are numerous ones out there. But what they're not able to do is characterize those key drivers of event. These tissue types, like lipid-rich necrotic core and intraplaque hemorrhage, are heterogeneous in nature, meaning they don't have a uniform density. So if you're looking to use Hounsfield unit thresholding, you're actually not able to characterize them because you cannot define the range that they would fall into. So as such, you have a tool that acts as a proxy, but it doesn't give you actual information validated against histopathology, where we can then use that to derive models that predict what is the likelihood of this patient suffering a heart attack, what is the likelihood of them suffering a stroke. So we think that's a key differentiator that we're bringing to the market, and it took numerous years to get here.